The quiet warnings no one talks about. Has someone you love started showing subtle but concerning changes in the past year? Many people assume that death in old age happens suddenly, but the reality is far different. The body often gives quiet warnings, sometimes months or even a year, before reaching its final stage. The problem? Most people miss these signs. They seem small at first, just part of aging, nothing to worry about. Only later, looking back, do families realize the clues were there all along. But by then, it's too late. Too late to prepare. Too late to make those last memories truly count. In this video, we're going to talk about 5 key signs that often appear a year before an elderly person passes away. Some of them may be things you've noticed but brushed off. Others might seem like minor changes, but actually signal the body's gradual decline. Recognizing these signs early gives you the chance to provide better care, create meaningful moments, ensure their final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. Instead, you'll be able to make the most of the time you have left with the ones you love. Now, let's get started. Sign number 1. Significant weight loss. One of the earliest and most telling signs that an elderly person may be in their final year is unintentional weight loss. At first, it may seem small, clothes feeling a bit looser, a belt needing an extra notch, or meals left unfinished. Families often dismiss it as just part of getting older. But the truth? Losing weight without trying is rarely a good sign. It means the body isn't absorbing nutrients properly. Muscles are breaking down, and vital systems are slowing. Aging naturally leads to some muscle loss, but when it happens too quickly, it's a sign of a deeper issue. The body may be struggling to digest food properly, no longer processing protein efficiently, leading to muscle wasting, redirecting energy away from digestion toward essential functions. The consequences? Less strength, a weaker immune system, and higher risk of infections. Another factor? A fading appetite. Many elderly individuals stop feeling hunger the way they used to. Their sense of taste weakens, food no longer excites them, and they start skipping meals. Not out of choice, but because the body is shutting down. Families often try to encourage eating by offering favorite foods or protein shakes. But if weight continues to drop despite these efforts, it's a warning sign that diet isn't the issue. It's the body preparing for a deeper transition. At this stage, forcing big meals won't help. Instead, focus on comfort. Provide soft, easy-to-eat foods. Hydration. Keep them drinking enough fluids. Small portions. Make meals feel manageable. If you notice significant weight loss, especially combined with fatigue or weakness, it's time to pay attention. This isn't just about appearance. It's the body sending a message. Understanding it now can help you prepare with clarity, compassion, and the ability to make every moment meaningful. Sign number 2. Extreme fatigue and weakness. One of the most noticeable changes in the final year of life is persistent exhaustion. This isn't just feeling a little tired after a long day, it's a deep, overwhelming fatigue that doesn't go away with rest. Getting out of bed feels like a struggle. Walking across the room requires effort. Everyday tasks, cooking, dressing, even holding a conversation, become draining. This isn't just normal aging, it's a sign that the body is conserving energy as organ function begins to slow down. The heart doesn't pump as efficiently. Circulation weakens, muscles don't get the oxygen they once did. That's why many elderly individuals in their final months sleep more, needing frequent naps during the day. Lose stamina, finding it hard to stay awake for long periods. Have sudden energy drops, feeling fine one moment, then completely drained the next, the hardest part? The emotional impact. Many seniors take pride in their independence. When they start losing strength, they may feel frustrated, embarrassed, withdrawn from social interactions. They stop trying, not because they don't care, but because they simply don't have the energy anymore. For families, it's painful to watch. You may want to push them to do more, but at this stage, forcing activity won't help. Instead, focus on letting them rest when needed, creating peaceful, comfortable moments together, cherishing conversations without expectations. If you notice a loved one struggling with deep fatigue that isn't relieved by rest, don't ignore it. This is a time to support them, be patient, and make sure they feel loved and understood. Sign number 3. Increased confusion or withdrawal. As someone nears the final stage of life, one of the biggest shifts happens in their mind. You may notice that someone who was once sharp and engaged starts forgetting things more often, struggles to follow conversations, seems disoriented even in familiar places. This isn't everyday forgetfulness. It's a sign that oxygen and nutrients aren't reaching the brain efficiently. As circulation weakens, cognitive function starts to decline, leading to sudden moments of confusion, forgetting names, losing track of time. Emotional withdrawal, speaking less, spending more time in silence. Mood changes, becoming more irritable or, in some cases, unusually calm. At this stage, social interactions feel overwhelming, and loud environments may feel too stimulating. For family members, this change can be especially hard. Seeing a loved one become distant or lose touch with reality feels like losing them before they're actually gone. The best thing you can do? Speak gently. Offer reassurance. Be present, even in silence. Even if they don't always respond, they can still feel your presence. And that matters more than words. Sign number 4. Frequent infections and slow healing. As the body enters its final stage, one of the most noticeable physical signs is a weakened immune system. You might observe that a loved one who rarely got sick before now seems to catch every cold, every flu, or every minor infection that goes around. What used to be small illnesses now take much longer to recover from, and simple wounds, like a small cut or bruise, may heal at a noticeably slower rate. These aren't random occurrences. They're signs that the body isn't able to defend and repair itself the way it once did. One of the biggest concerns is repeated infections. Pneumonia, more difficulty breathing, persistent coughs, urinary tract infections, UTIs, unexplained confusion, discomfort, or fever, skin infections, redness, swelling, or sores that don't heal properly. Many families assume these are just isolated health issues, but when they start happening frequently, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. Your loved one might need stronger medications, longer recovery times, or multiple rounds of treatment for infections that would have once been minor. This happens because as circulation slows and organ function declines, the body struggles to respond to treatments. In some cases, even aggressive medical care may no longer help, as the body simply lacks the strength to heal. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's natural to push for stronger treatments, hoping one more hospital stay or medication change will fix things. But at a certain point, the focus often shifts from curing to comforting. At this stage, what can help most is keeping them hydrated and comfortable, keeping their skin clean and moisturized to prevent wounds, reducing stress on the body rather than forcing unnecessary interventions. If your loved one is experiencing frequent infections or slow healing, it may be time to reassess their care plan and focus on comfort over aggressive treatment. Because, in the end, ensuring peace and dignity is more important than prolonging suffering. Sign number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one's breathing becomes more shallow or slows down significantly. At times, they may pause between breaths or have irregular breathing patterns where they speed up and then slow down suddenly. Some people experience a pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. This can happen gradually, but over time, it becomes more frequent and more pronounced. Another common sign is weakened circulation. You may notice that their hands and feet feel cold to the touch. Fingertips, nose or ears start turning pale or bluish. Skin appears mottled, patchy discoloration, especially around the legs and arms. This happens because the heart isn't pumping blood as efficiently, and the body is redirecting circulation toward vital organs. Some individuals may also struggle with shortness of breath, even while at rest. You may see them breathing through their mouth more often, taking long pauses while speaking, feeling winded even after minimal movement. For some, fluid buildup in the lungs can make breathing more difficult, leading to a persistent cough, a gurgling sound when breathing, a feeling of tightness in the chest. Many families assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. At this stage, certain small adjustments can make a big difference. Keeping the room cool and well ventilated, using a humidifier to ease breathing discomfort, offering small sips of water to keep the throat moist. Some may benefit from oxygen therapy or medications, but the focus should be on comfort rather than medical interventions. If you notice changes in breathing or circulation, pay close attention. These signs often indicate that the body is conserving energy and slowing down. This is a time to be present. Offer reassurance. Create a peaceful environment where they feel safe and at ease. Because in the final weeks or months, the most important thing isn't medical treatment. It's ensuring comfort, dignity, and a peaceful transition. Final words. What this means for you. Now that you know these 5 signs, take a moment to reflect. Have you noticed any of them in someone you love? The truth is, no one wants to talk about the end of life. But understanding these changes isn't about fearing death, it's about being prepared for it. When you recognize these signs early, you can make important decisions ahead of time. Ensure your loved one's final months are filled with love and dignity. Focus on meaningful moments instead of medical interventions. Because, in the end, what matters most isn't how long someone lives. It's how well they are cared for, how much they feel loved, and how peacefully they can transition. If you found this video helpful, like, subscribe, and share your thoughts below. Your support helps us continue creating valuable content to inform and inspire you. Thank you for watching. Stay strong, stay wise, and cherish every moment.